Last, we have Hans-Peter Kohler from the Faculty in Demography.
Demography, yes, democracy.
From the School
We'll
of
support
Art and
democracy as well,
It was
but
a
I'm
different school.
going to focus on demography in my talk and not get into trouble by talking about something else. Thank you very much for inviting me. Thank you for supporting global health at Penn, for supporting our project in particular. In addition to Botswana, where Penn has a long-standing partnership, Penn has another one that is very long-standing, 25 years and counting, and that is to Malawi. Malawi is strikingly different to Botswana. It's one of the poorest countries on the continent, and this project is different by starting in a different corner of campus. Rather than seeing global health as a biomedical problem, we see it as a social science problem. That social science is an important part to understanding and improving the health of individuals globally. So this project started off in an interest in fertility decline, lots of HIV research. I'm going to talk today about its interest in aging. And importantly, this has also integrated from a social science perspective to a very strong school connection to the Perelman School of Medicine, to the Center for Global Health, but also genomics, cardiovascular disease, and other ones. So the reason is about aging, right? So the world is getting older, and the question is, what do we know about aging? And we know a striking amount of how individuals get older and these things in relatively affluent countries where population aging is concerned a major issue. We know strikingly little about aging among the poorest individuals in the world. But this is where some of the most rapid aging comes about. And so we've been trying to leverage this study that's been going on for 25 years to develop a fairly unique low-income country aging study, where we've been following the same individuals for roughly about 25 years. We've collected 14 rounds of data on them. This is a population-based sample. We're just going up on a data collection for their grandchildren at the very moment, and try to push the frontier in what we know about population aging by taking a life course perspective on getting older, understanding health at older ages, bringing in social science data. We have the only longitudinal data on cognition in a low-income country in Africa. We expanded this cognition work last year to allow the diagnosis of dementia to, for the first time, be able to do research diagnosis of dementia, understand cognitive decline dementia in a life course perspective. We've collected dried blood spots. We've done them genetically sequenced. We've computed epigenetic clocks. We hope to do, in a strikingly different context, what is the benchmark for contemporary aging research in high-income countries by integrating social science with biomedical areas, life course perspective to do social science or biosocial aging research. And we hope to do this in Malawi, where kind of individual income levels are roughly on $1 a day, to kind of truly innovate and change how individuals age. And on first hand, it's an observational study. We want to understand this. And secondly, we want to then obviously inform policy. We're fortunate that we have, over these 25 years, built up very, very strong relationships to our partners in Malawi. There's a very close collaboration between Penn and partners in Malawi. We're grateful that we have a visitor coming to the Center for Global Health this summer. And I invite all of you to kind of engage with us in research on health, aging at older ages, taking a social science life course perspective, using these data, right? 25 years I've been involved from the very beginning in this, because I think we can make some very distinctive, unique contributions to an understudied phenomenon in a context like Malawi. Thank you so much.